while they're putting the talk up, I was putting it together and I realized that I'm describing an issue. I'm heightening awareness. That's what Fox News does every day with why liberals and immigrants are ruining the world. But I'm not solving a problem. And that's what really we care about in medicine, in life science technology, and life science drugs. We want to solve problems. So I'll raise your awareness at the beginning, and then I'll throw out a few stabs at solving a problem, but it's a problem that everybody in this room and lots of people outside this room can contribute to solving. So life science diamonds in the rough. Let me first tell you a story. Anybody recognize these guys? Dr. Barry Marshall and Dr. Robert Warren discovered that Helicobacter pylori causes gastric ulcers. Back in the 80s when they made this discovery, everybody knew that it was caused by stress. And changes in your stress, diet, and lifestyle and a lifelong prescription for high-strength antacids was what you needed to control this chronic disease. But in 2005, they won the Nobel Prize for their early 1980s discovery that there's actually an infectious organism, and you can treat it with antibiotics and you can cure people. It took almost 20 years for that discovery to become mainstream because there was tremendous resistance to changing the paradigm of prescribing antacids and changing diet, stress, and lifestyle, which everybody knew for decades was the real problem. But eventually we got there. We got to the right situation. But what most people don't know is this gentleman, Dr. John Weickert from Greece. He had peptic ulcers, but he actually treated himself with antibiotics in 1958 and cured his gastric ulcers. And he developed an antibiotic treatment that was awarded a patent in Greece in 1961. And with that treatment, he cured an estimated 30,000 Greeks of gastric ulcers. He couldn't interest any pharmaceutical companies in it. He tried to publish the results in JAMA in 1966, but they rejected it, and the Greek medical authorities fined him for malpractice in 1968. So we had the solution, and it was tried on tens of thousands of people successfully, and it was ignored. This is what we call a life science diamond in the rough that was never found, that was never prospected, that was never cut and polished and provided to patients. So patients spend an extra 40 years without proper care for no good reason, other than this never got traction. So what is a life science diamond in the rough? It's a genuine breakthrough. First and foremost, it's disruptive to the status quo. It's disruptive to the conventional wisdom. It's disruptive to what everyone already knows is how or why this current process works the way it does. It's an innovation that arises outside of the current scientific paradigm. If you understand a disease, but you can't do anything about it, you probably don't understand the disease. So it's outside of that. It's also outside the conventional thought leadership circle. So if you're a thought leader, you're invested in exactly what the current paradigm is. That's what you've been spending as your life work. It's generally from outside that circle. There's usually no prior history from the innovators of founding a company, so they don't have any sense of what's required, what it's going to take, how to go about doing it. And they're usually not affiliated with a marquee institution like MIT or Harvard or Stanford. What's a breakthrough, or what do you get when you get a real breakthrough? From the standpoint of a company, you get some really valuable things. You get what we call IP white space, meaning that if you really have a breakthrough that's going against the grain, against what everybody else teaches you're supposed to do, then that means you're likely to have the opportunity to create intellectual property that covers something that no one else is covering and allows you to put a lot into protecting your future products, which is so important to medical technology. You also may have what's called first in class, meaning a product that genuinely is in the forefront of a new therapeutic approach. And a first-in-class product that's very well protected has a tremendous revenue potential. So those are all things that should be really attractive. And we need breakthroughs. Sepsis is the third leading cause of death. You know how many drugs we have approved for sepsis? 0 in the US. 0 in Europe. So clearly, we do not have this under control at all. That would be a great place for a breakthrough. Cancer, we all know even better than sepsis, is an area with a tremendous amount of research right now, a tremendous amount of attention, but even after 40 years of progress in cancer, this chart shows you that the average mortality 10 years out for cancer, the average is 50%. 50% of the people with cancer, any kind, make it on average. And some cancers down here, stomach, brain, esophagus, lung, pancreatic cancer, we've made almost no progress at all in 40 years. We need breakthroughs, and we need them economically too. The pace of drug development, discovery, device development and discovery is slowing. The cost of each new innovation is increasing. So you would think we would be out all the time looking for breakthroughs. But the thing is, we often look for the insiders to make the breakthroughs. But in fact, it may be a necessary condition for many breakthroughs for the people to be outsiders, for the innovators to not be part of the status quo. Because if you're invested in the status quo, you're more likely to be subject to confirmation bias, looking for things that confirm your theory rather than looking for the truth. And it's not somebody's doing something evil or nefarious. It's a normal human condition to want to confirm the things you already believe. People who are on the outside are usually focused on solving a problem, not advancing an agenda. They're also looking at things holistically. They don't have a body of work that they're continuing to add to and support. They're able to look at everybody's work equally and look at all the opportunities that other people are presenting to the scientific community and say, I like how these things fit together, and see unique patterns that others have missed. Barry Marshall said this very nicely in an interview he gave to Nature just a couple years ago. He was talking about how he came to this discovery, and he basically said, I didn't believe the conventional wisdom. So I looked for evidence-based causes. The conventional wisdom at this time not only was that stress caused ulcers, but that the stomach could not support the growth of microorganisms, so no one ever looked. As soon as they discarded that conventional wisdom, within months they found Helicobacter pylori. From the time they started on this until they had the solution, it took them less than a year, because they were able to ignore the conventional wisdom and look at things in a new way. So in 2016, I saw that Bio had a panel that sounded really exciting, and like somebody was really onto the same track. And it was the bright shiny object, or the bright shiny thing, a challenge of true innovation. So I went to the session and I listened to them talk about how true innovation, what are the things we need to do to foster innovation in large pharmaceutical innovation centers and incubators. And at the end I stood up and said, you know, true innovation is happening all over. You're just not looking for it, okay? You're just staying with the same model and saying, how do we force that model to work differently? And it's already happening. I said, you need to go out and prospect and find things. And you know what the panel said? The panel said, well, you know, if this is a really true innovation, it's going to come around again. And we'll see it then. And this is what I call the streetlight syndrome. It's like the old joke, guy's looking underneath the streetlight and somebody comes by and says, what are you looking for? And he says, my keys. He says, well, where'd you lose them? He says, over there. Why are you looking here? Because this is where the light is. So the idea is, okay, if an idea is really good, it's going to come up multiple times, and one of those times it's going to come up under my streetlight, and I'll see it. I think we can do better. I think we have to do better than that. So here's an example of somebody who's under the streetlight. Bob Langer is probably the most successful engineer there is in the world. He has a tremendous number of publications and patents. He has a lab of over 100 people at MIT. Lots of companies, hundreds of companies, have licensed IP from his lab. And he's been a co-founder of more than 30 companies himself. I actually had the pleasure of working with one of Bob Langer's companies a year or two ago, Taurus, which is just a little ring that allows you to deliver drugs in the bladder. Okay? That's not what you would consider a huge monster idea, but that first deal they did could be worth more than $500 million, which is pretty impressive. And what Bob has going for him is he's in Boston, and I'll talk about the importance of geography in just a little bit. He's at MIT, that's one of those marquee institutions I was talking about. And because of all this company experience, he's highly bankable. Anything that falls off Bob's bench is going to get funded. So contrast that with Dr. Jay Pravda. Dr. Jay Pravda has been working on a lot of different diseases, and I'm going to show you one. Ulcerative colitis is a very important inflammatory bowel disease along with Crohn's disease. It's one of the two key inflammatory bowel diseases, and he published a new theory on this in 2005. And then he went further. He designed a therapy based on that theory and found a partner with a big gastrointestinal practice, a GI practice, that he could test this in patients with. So in ulcerative colitis, you're looking for remission. When a patient's symptomatic, you want to get them back to an asymptomatic state. And this happens about 20% of the time spontaneously in 8 weeks. And if you give them the best therapies that we currently have on the market, in Remicade or Lialda, which is a 5-ASA product, if you give them either of those products, you get about double the spontaneous remission rate. You get up to 40%. Okay, that's not really impressive, frankly. But if you use Dr. Pravda's method, you get 86% of patients in 6 to 8 weeks get into remission. And it's not just they don't have symptoms anymore. It's that at the endoscopic and histologic level, down to the cellular level, there's no trace of disease. He might be onto something. But the problem for Dr. Pravda is he's a Florida general practitioner immunologist. He has no institution that he's working with. He hasn't founded a company before and made a lot of money. So his bankability is zero. His ability to get attention for this and traction for this is almost non-existent. So I told you I'd talk about geography. Well, this is one of the reasons why geography is so important. There are two places you can get funded: San Francisco and Boston. I mean, obviously you can get funded everywhere else, but this is the 2017 healthcare funding data. Just came out a week or so ago up at JP Morgan. And you can see that the vast majority of the money is in two geographies. And it's not because all the universities are there. This is a plot of the 50 biggest national universities. And Boston has some great ones. I mean, they have Harvard and MIT, and so does San Francisco. You got Berkeley, you got Stanford, UCSF. Okay, but 10% of the top 50 universities does not mean you should get the vast majority of the investment dollars. There's something wrong there. And a group from Harvard, naturally, did an analysis of the venture capital flows for 57,000 deals over a decade. And they looked at where does venture money go to and where does it come from. And they came up with three kinds of cities. You got a self-sustaining city where there's lots of local investors investing in lots of local companies. You've got a finance center. There's plenty of capital. There's not much in the way of companies. And you've got tech hubs. Lots of ideas, lots of technology, not much money. And those three characterize most of the places around the country. But the self-sustaining cities are pretty limited. I think San Francisco and Boston are the only ones. Everybody wants to be one, but there are only two. I think there's a third dimension to this. There's the capital, the ideas, we've already seen that, and the talent. So execution is really critical to taking an idea and making it into a product. And that's what's also missing in a lot of the tech hub type locations. So when you put this extra dimension on here, in a self-sustaining city, you have all those. You know, Boston and San Francisco have plenty of people with experience developing products and meeting regulatory requirements and doing clinical studies and everything else. So those two locations have all you need. Finance center, they got capital. Pretty much that's it. A tech hub, they have ideas, they have some talent, but a lot of times they don't have all the talent they need for developing products all the way to market. They have the talent needed to do the early steps, but not the end game. So if you're a life science diamond in the rough, your major issue is money. Okay, that's what you think your major issue is. I need money. But you also need to get taken seriously, which is affecting your ability to get money. If you're out in the boonies and you've got a new idea and nobody wants to publish it or you don't get a grant for it because the status quo people are the editors and the grant reviewers, you got a problem. I mean, getting traction becomes a real issue, and getting financing as a result becomes a real issue. But you also need business and product development talent. A lot of founders of companies that are outside there, that are life science diamonds in the rough, do not have that experience. But there's another thing that's going on, and it's how a lot of these founders get in their own way. And I could do a talk on this on its own, but there's a book already written about it called The Founder's Dilemma, so I don't need to do that. You can all read that. But there's a lot of ways that founders who don't have experience, who might have brilliant ideas, get in their own way. And one of the keys is value mismatch. So if you have a great idea, it's worth everything, because without your great idea, nothing's going to happen. But the problem is that the people who supply the skills, the talent, the experience, and the money to get things all the way to market, to make things actually into products that can interface with patients, that can change lives and save lives, those people know that that's 95% of the value, is the execution. And so you've got the idea generator thinking that they should get all the upside, and you've got the people with the capital and the experience saying, no, we know we deserve the upside, and that value mismatch can create a lot of friction and tension that gets in the way of getting these great ideas traction. If you're an investor, your issues are, where do I put my money, where I'm going to have the biggest impact? When am I going to put it in those companies, and how I'm going to manage the risk associated with putting that money to work? One of the biggest risks, and the reason why investors focus so much on teams and working with people who have a track record and teams that have all the elements necessary for success, is because when you poll those venture groups and ask them where the problems come from that end up with either deal breaking or team breaking or company breaking issues, it's the teams that come up at the top. 65% of company failures in the portfolio are at least in part due to the teams, and 61% of the problems in their portfolio companies now are due to management teams. It's not always the founder teams, but it often is. So investor risk mitigation comes in a lot of different flavors. I'll talk a couple of them right now. One is invest later. And you've seen a lot of this since 2008. So investors used to invest in early, middle, and late, but there's a hell of a lot of attrition in early and middle stages. So let's just invest in the late stage. It costs us more, but more of those things will get to market, more of those things will get to exit, we'll get more frequent successes, even though our return might be a lower multiple. And some of these investors are actually doing some really interesting things where they build to buy. You find a buyer for an idea, and they build a company to make it. So they know they've got an exit path if they can successfully execute. And they build a company around the idea. Talent issues, and this is talent both in the terms of sort of service providers and tech hubs that have talent and ideas but want to get financing and traction. There's a real challenge in matching talent to the ideas. Company founders, life science diamond in the rough founders often don't know what they need. They don't know who they should go to. They don't know where to access the people with the right ideas. You got to pay for that talent. Those people are making a living doing this. If you're a professor at a university and you have your salary and this innovation came out of your lab and you're spinning out a company, you're comfortable. If you want to hire somebody to do regulatory, they're not a professor at a university getting a salary and doing this as a hobby. Okay, that's their livelihood. They got to get paid. And you get into this chicken and egg problem where I need to pay for talent in order to make me attractive to investors, but I need the money from the investors in order to pay for the talent. So what am I going to have tonight, chicken or omelet? Madison has the makings of a lot of potential for emerging from this. They have big university, University of Wisconsin, tons of medical-related innovation there. They have Wharf, a foundation with over $3 billion in assets, although most of those assets are plowed into very conventional investments rather than into medical investments. They have small local VCs, some of which have offices even in the Bay Area. And they have about 50 incubator or startup organizations, each one with almost no capital, almost no people, okay, and many times that don't survive for very long. And frankly, what they need is they need 5 or 2 or 1 well-supported, well-staffed organization that can help startups, can help their life science diamonds in the rough get traction. And I'm going to tell you a little bit about an example that I belong to. It's unfortunately in one of these hubs, because that's where I live. I live in San Francisco. So I'm a mentor at Spark. And this is a picture I took Wednesday at the Spark meeting, where you can see a lot of people get together every Wednesday night to help 12 to 15 projects a year from the Stanford Medical School make the transition from great ideas into animal, human, or other proof of concept necessary to decide, number one, do you have a company? And number two, is it fundable? And to put together the data that will allow you to do that. There are over 160 advisors and mentors from across industry available to these projects. And as you can see, probably 100 people getting together every week to listen to those companies' problems and to help them find solutions. That's, you know, it's ridiculous. It's Stanford. They need the help? No, but this is what a group like Stanford can offer and pull together. But other places can do something similar. In fact, Spark has fostered over 20 startups in its 10-plus year history from this program, as well as another at least 6 IP licensing deals. And they're franchising this out. So, you know, they're not there just to say we only service Stanford. They've taken this idea and they've shared it across the world. There's a wonderful TED Talk that you can look at where they talk about what the idea is about and how to do it. And they've been working with organizations all around the US and the world to help other communities and other institutions put together similar programs so that they can help their companies bridge. Am I done? Yeah. Anyway, the last stuff I had is actually the stuff I care least about, because it's where I take crappy stabs at solutions. But one thing I want to leave you with, you know, you can be in Madison and be a success story. Epic is the world leader in electronic medical records. They were founded in Madison. They stayed in Madison. The founder is still the CEO. They have $2.5 billion in revenue, 9,000 employees. It's a big success story from a small place. So anyway, thank you very much. I'm happy to talk to you more about this. I'd love to hear your ideas for how to solve this problem. Because like I said, raising awareness is only half the issue. The real problem is how to fix it. Thank you.